I'm Dr. Chirantika Vitana, Consultant Community Physician, handling Adolescent and Youth Health Unit, National Program Manager, Adolescent and Youth Health, Family Health Bureau, Ministry of Health. Today we are starting the session 20 of Adolescent and Youth Health Workshop. It is on Adolescent and Youth Friendly Health Services. Objectives of today's session are to describe the following: the need and importance of adolescent specific health services, what is meant by health services, role of health service and healthcare providers, barriers faced by adolescents and youth when coming to health services. And further, to learn how to make health services adolescent youth friendly. Measures to improve quality of adolescent youth friendly health services. We can abbreviate this as AYFHS, that is commonly used. So, measures to improve quality of AYFHS. What is in service package of AYHS and suggestions for improvement. Now we move on to the basic concept. It is health improvement of young person, factors influencing young person's health, role of service providers, improving competence, improving coverage. So we will cover all this. Is there a need for specific targeted health services for adolescent and youth? If we take Sri Lankan statistics, we have a population of 20.4 million. Out of that, 4.8 million are adolescent and youth. So, we call 10 to 24 group as young person. So, we are having 1/4 of young person. And when we come to adolescent, 16% of total populations belong to 10 to 19. If you come to youth, that means 50 to 24 group, nearly 16% of population are youth. So, 1/4 of our population are young persons. So, they are very important. If you invest on childhood, you will get healthy adolescent. If we invest on adolescent, we get healthy adulthood, and that will carry on to next generation. That is the investment of adolescent health. So, we will have benefits through next generation as well. We have discussed about the main health issues like early pregnancy, lack of access to sexual reproductive health services, sexually transmitted diseases, other infectious diseases, mental health problems, violence and injuries, alcohol and drugs, tobacco use. These are major concerns, major health issues among adolescent and youth. And again, one thing we cannot forget is undernutrition and overnutrition. That means obesity and thinness or undernutrition. And also there are conditions like anemia, micronutrient deficiencies, lack of exercise, and nutrition is a main health issue among this group. We have discussed about the conceptual framework of adolescent and youth health. A life cycle approach to be healthy within the life cycle is important. In addition to that, social determinants, digital determinants like national wealth, education, health, proximal determinants like risk and protective factors are operating on them. So that ultimately lead to health behaviors among adolescent and youth and health outcome. On top of that, policies, preventive health care, curative health care all affect the adolescent in healthy and having healthy behavior. So, what are the services preferred by adolescents? There are evidence-based data. Here, dark blue line shows that they need specified youth-friendly health services. Right. Next thing is from another survey, they prefer to come on weekends, whereas our services are usually on weekdays. What are the health services and contributors for AYFHS? Now we will move on to it. Health service means a service preferred by health worker to a patient aimed at preventing a health problem or detecting and treating one. It is often included as provision of information, services and counseling. Adolescent-friendly health services or youth-friendly health services, that term was used in certain countries, are those with policies, attributes that attract young people to facility or program, provide a comfortable and appropriate setting for serving young people, meet their needs and are able to retain youth for follow-up and repeat visits. So, it should attract, it should be youth-friendly, it should cater the needs of youth, and youth will come back to us and follow-up and repeat visits are conducted because of youth are coming to us. Young person and good health. This is in diagrammatic form. For we are catering for adolescent. Adolescent mean here young person actually, adolescent and youth. First thing to have influence on them is family, parent, sibling, close family members who are within their home. That is very important in ensuring adolescent health. Next circle is own family friends, teachers, religious leaders and others. That is also very important. Then third circle is coming. That is society that influence them after that. Society means not immediate society, we took as second circle, musicians in the country, sport, film stars and etc. Fourth circle actually has a similar effect, that is politicians, journalists, businessmen and the key figures, that means policy makers of the country. So, we will see the role of health services and healthcare provider. What are the roles of health services and healthcare providers? You might have heard about health promotion and secondary prevention. What is health promotion? Helping well adolescents to stay well. That means helping healthy adolescents to stay healthy. Helping ill adolescents get back to good health when required. When young people are inflicted with diseases, unhealthy behaviors, they have to get back to healthy status. So, that is secondary prevention, include treatment. So, we are talking about service provider activities. Service provider is very important. Provision of information, advice, counseling aimed at promoting health and preventing healthy behavior and problematic behavior. Diagnosis, detection, management of health problems and problematic behaviors. Refer to other health and social service providers when necessary. As changing agents in the community. So, healthcare providers has a role to change the society. Make contribution in helping educators. So, we are developing educators, religious leaders, political leaders and understand the need and others to understand the need of adolescents. The credibility and influence they have in the community to be used to help influential community members to make adolescent health seriously. Working together to meet the needs and working with adolescents. It includes provision of information, advice, counseling to young clients regarding their health problems, diagnosis and management of health issues, necessary referrals within the health system and outside the health system, and change the community, that we have a big role, and developing and making aware health educators, religious leaders, key figures in the society to need of adolescent investment, and influence the community to invest more, work more on adolescent health, and working together to meet the needs with youth participants. So, as for other services, barriers are faced for adolescent and youth. Now, we will see in their journey what are the barriers for adolescent and youth coming for AYFHS. So, there are barriers we all identify, and that is evidence based. So, what are the barriers faced? There are 3 stages. Barriers faced by adolescent and youth, barrier issues related to health facility, that means operational barriers when we are providing services, what are the barriers, and issues related to service provider, and policy issues. There are certain policy issues and issues related to young people. So, there are 4 levels of barriers: issues related to health facility, healthcare provider, and regarding health policies, and issues related to young persons. So, we will discuss. Competencies required by service providers are, what are the competencies? Consultation skills, interpersonal communication skills, interdisciplinary care skills. So, barriers consist of certain categories. Availability, having services is a barrier. Accessibility, youth going to services, how feasible it is. Acceptability, how youth would like to come, how would they accept our services. Equity and equality, we will discuss about it, equity and equitability and equality also. Services should be like that. What is equity and equality? Equity is the quality of being fair and impartial, justice according to the natural law, freedom from bias and plagiarism. If there is a poor community, they need more services than some having healthy lifestyle and all. So, we are catering for this most need group. And even in a marginalized population, there may be certain priorities. So, we are catering for priorities. We are here giving priority for the most needy group and needy activity. That is equity. That is according to the natural law and right. Equitable or equal, we are giving equal and balanced care for everybody. These 2 concepts should go hand in AYFHS. Now, we will move on to making adolescent and youth friendly health services. So, we have health services everywhere. How we can make them adolescent and youth friendly? How to make health services adolescent youth friendly? We will discuss. So, there are characteristics of provider. The healthcare provider should be specifically trained on youth friendliness. They can provide services, but services should be youth friendly. They should have respect for young people, and privacy and confidentiality should be valued and established. Adequate time should be spent with young client, and there should be good interrelations. The healthcare provider should have these communication skills. And when it comes to the characteristics of the AYFH center or YOMPS center, there should be a separate space for services, convenient opening time, comfortable environment, space to ensure privacy, availability of required supplies, telephone hotline, conference room, library, resource room with books, leaflets, audio visuals and research reports. So, if center is having all these, it is youth friendly. But healthcare provider should be youth friendly, and when we are designing program, there are certain other characteristics we have to ensure. Youth participation should be ensured at all stages in planning, service implementation, and their inputs for monitoring and evaluation, extending a warm welcome to the client, young client especially. They, unlike adults or antenatal mothers, they will not wait for half an hour or 1 or 2 hours at the clinic. They want services just at the time they come. Absence of overcrowding and short waiting time, that is very important. They don't think they are ill, so they will not wait. And affordable charges. Actually, government services are free of charge. If it is happening in private sector, it should be affordable charge. Publicity of the center should be established in the area where young people gather, and also among their parents and the community. There should be outreach activities. Some people will not like to come to hospital and they will not come to MOH area. One of the surveys we did among youth, they like to have a separate center where all other facilities are there away from the healthcare facility. Next favorable option of them are to come to medical officer of health, the person they knew from their childhood. And last option they liked is to come to hospital. Availability of wide range of services. If they have a problem, there should be service provision. Strong linkages developed with other sectors. Sometimes we will have to refer them to the social service and other sectors, so career guidance. So there should be linkages. And availability for necessary referral mean that. And there should be IEC materials, providing them knowledge. So, we will talk about the settings on adolescent youth friendly health services. So, in globally there are several models tested. Some countries there are institutional based centers in hospitals. Some there are mobile outreach programs. Some countries there are separate centers. So, in our country also there are adolescent youth friendly health services at hospitals. We can have them at workplaces, public private NGO clinics also we can have, shopping complexes even we can have, and pharmacies also. If they want SRH things, family planning or something, there should be a feasibility of taking them. And refugee camps, youth centers, on street, and education, training institution. At all these points, we can provide adolescent youth friendly health services. So, these institutions are for something else, but they are the point where we can provide adolescent youth friendly health services. Our outreach program, as we discussed, is important. So, improving the quality of adolescent youth health services, you might have heard, quality improvement is one of the targets globally, and also nationally. In order to provide quality health care, what is the definition? It is defined as doing the right thing for right patient at right time in right way to achieve the possible results. Actually, the possible best results. So, right thing, right time for right patient or right client in a right way in order to achieve positive results. So, what are the measures to improve quality of AYFHS? What are the measures to improve at hospital, medical officer of health area, a mortuary or field, making all service providers adolescent youth meet. That means OPD, whatever other places where adolescents and youth are coming, to make those places adolescents and youth friendly. So, you might have heard about quality care framework. Dimensions include accessibility, acceptability, equity, equitable, appropriate, effectiveness, and we will move on to adolescent health services. We will talk about client should aware about the available services, community should aware about the available services and need of services, community should support provision of services. So, there are services and we should know how to improve services. Improving competency is very important. In individual care, how to improve well-being, health promotion, it is important. How to deal with specific health or behavior problems. There we need competency. And managerial competencies are important. Management of service effectively and efficiently. That is what we expect as competency. So, individual care, there should be competencies and healthcare workers should be competent on health promotion, dealing with the specific behavioral problems, and also center and outreach program should have managerial competencies. So, improving accessibility is one of the important things. Services are there, but they should be accessible. Availability is important. Now, we are moving on to accessibility. It includes improving certain aspects. The client should be able to come. So, we have to take into account distance, cost, timing, being observed by others. Adolescents don't like others to observe them. They want privacy and confidentiality. If they think we are providing services, ensuring privacy and confidentiality, they will come to us. If they will think that we will listen to them and tell everybody their problems, their parents or teachers or anybody, they will not trust us. So, first we have to improve their confidence on us. These may be addressed by discussing with potential client and arriving at suitable alternative may be the best option. So, we want to improve accessibility. So, how can we do? We can have certain surveys with youth client, parents and other gatekeepers, and we will identify what will work best and what is suitable for it. So, becoming more welcoming is important in quality. Healthcare provider should be a sensitive person and should have positive attitude. Should not judge young person from their dress or appearance. So, we should not do any discrimination. And improving coverage is very important. Some form of outreach or extension of services are needed. Informing public about availability of the services, inviting young people to come to us, attend to the clinic, and encourage all those in need to attend and seek services at centers. So, public health midwife is visiting homes and encouraging them. Reach young person in great need who may not be able to access the services. So, there are people, non-school going adolescents, they will not be at home, they will not be at training center, they will not be at school. So, we have to improve their coverage as well. Obtain services of field staff to attend to most needy people. So, field health should go in parallel. Field health should have adolescent youth friendly health services and they should involve in hospital with hospitals also. Improving immediate environment of the center is important. So, expansion of coverage include mainstreaming of services, school health services. From that point, we can refer the client to IYFHs. And e-health, this is a era of technology. They will people have advice through internet, e-health and mobile health. They would like rather chatting than coming to our center. So it is very important in increasing coverage. So platforms for adolescent services. One thing is, are there adolescent-friendly health services everywhere? One thing is government health service. In private health services also it is important. And schools. And mobile clinics, if we are going and conducting certain clinics. Pharmacies also should have adolescent-friendly health services. Youth centers, there are several youth training centers in the country. Ministry of Health is working with the Youth Ministry to incorporate adolescent health modules and have a link between Health Ministry and these institutions, and MOHs can visit to these places and provide services. So, youth centers are important. And as we discuss, e-health and m-health are also important component, and outreach programs also. So, monitoring and evaluation of services is essential. What is monitoring? What is evaluation? As supervisory staff, you all know. Supervising activities in progress to ensure that they are on course and on schedule. So, we are going to look whether they are on course and on schedule. It should be a supportive supervision. So, that is monitoring. Evaluation. So, we are determined to what extent to which the objectives of the services have been achieved. Have we achieved objective? Monitoring is, are we progressing to ensure we are on course and on schedule, and evaluation we are comparing whether we are coming for our targets. So, sir, what are the services available for adolescents in Sri Lanka? What are the adolescent-friendly health services? AYFH, Adolescent Youth Friendly Health Service. As healthcare providers or officers working on adolescent and youth, you are aware of it, but we will discuss. So, describe the service package of AYFHs in Sri Lanka. So, you might have heard about strategic plan on adolescent and youth health. So, the current plan is for 2018 to 2025. We are working on it. What is the vision on adolescent and youth health services? A country in which adolescent and youth realize their full potential for growth and development in conducive, resourceful, physical and psychosocial environment to be healthy, safe and happy. So, goals are adolescent and youth receive friendly, effective health promotion, prevention and care services through integrated health system and intersectoral coordination. So, adolescent and youth are getting timely, effective health promotion, prevention and care as an integrated package, and their intersectoral collaboration is there. What are our ultimate goal? To prevent all preventable deaths, that is survival, and ensure health and well-being. We are ensuring health and well-being, that is thrive, and transform, having enable environments. If we are doing these three, we have to do everything. So, there are strategic directions in adolescent strategic plan. I will read them out. One thing is leadership, governance, financing, accountability for AYH, Adolescent Youth Health. That is very important. Strengthening positive development of adolescent and youth. Strengthening health system to cater adolescent and youth. Promote psychosocial well-being of them. Ensure optimal level of nutrition, physical activity, hygiene and sanitation. That is very important. ensure access to SRH education and services, sexual reproductive health education and services. Prevent adolescent and youth from substance use. And prevent accidents, injuries, and violence among adolescents. Enhance community involvement to improve health of adolescent and youth. Enhance service provision in humanitarian settings or fragile settings. Strength, capacity, and partnership and networking with other stakeholders. And other last thing is research, monitoring, and evaluation. Last but not least important, it is very important we should have research, monitoring, and evaluation. All these 12 strategic directions covers strategic objectives, and we will not discuss the strategic objectives here. One major intervention taken to address health need in these groups are establishment of adolescent youth-friendly health services. Establishment was initiated in 2005, mainly there were hospital-based centers, but it was rebranded as Young Peers in 2015. So, what are the guiding principles for this AYFHS? Accessibility, acceptability, appropriateness, privacy, confidentiality, linkages with other sectors for competent health services. That is very important. Service should be available, accessible, acceptable, appropriate for the crowd. Then there should be privacy and confidentiality. Linkages should be with other sectors as well. So, what are the services provided? We provide information, befriending or counseling depending on the issue, clinical services, follow-up, referral, and linkages with other sectors in non-threatening or friendly manner. When we come to intersectoral coordination, we have to have coordination with the hospital, MOH office, school, divisional secretary, other NGOs, parents, and community. So, if you are having center in MOH, you should have linkages with other sectors. If you are having center in hospital, you have to have intersectoral coordination with other centers. What are the models tested for youth-friendly health services? Now, actually, we are discussing about what are the available models. Field health services. AYFHS provided through field health setup. Sri Lanka is having good public health setup. MOH areas, the leader is MOH. MOH team is providing care. So, one of their role is to provide AYFHS. And hospital-based care, 34 hospitals are having center. Center concept, that is the best concept, most preferred one by adolescent and youth. Their center is at a certain place away from health facility, and there they have sports, career guidance, internet, library, and everything. As a part of this package, there is availability of health services. So, they have confidentiality, youth-friendly environment and everything. Still, we can't go for this except for some models. And making all available service providers for adolescent youth-friendly. That is very important. So, in any of these service model, we have to do advocacy, resource mobilization, human resource training, supplies and equipment, referral path, and communication is important, supervision, monitoring and evaluation. This is discussed already. So, implementation of AYFHS we will discuss. So, you might have seen this diagram. In the bottom part, there are the point where AYFHS are provided. That is, hospital, 34 hospitals are there, 350 MOH officers are there. So, from where the clients are sent, from community, school, youth training center, workplaces. Anybody can walk into this clinic, or teachers, instructors, or healthcare providers can refer. They can come alone, they can come with parents, they can be self-referred or they can be referred. So, all these availability are there. In addition to that, there's a website called yompsa.lk. They can get health messages. And school health program, as program implementers, school health program include school medical inspection, health component in school curriculum, health promotive school concept. There are counseling officers in the school, and from that point also, youth are referred to AYFHS clinics. So, guiding principles for AYFHS is defined globally and nationally. It should be right-based approach, gender-sensitive, equity and non-discrimination, participation and empowerment of youth young person, non-judgmental approach, respect dignity and beneficiaries, privacy confidentiality, respect for law and country policies. Optimal service delivered to young person through building, strengthening essential linkages. So, we will move on to standards on adolescent youth friendly health services, AYFHS. So, you might have heard about the standards. We had developed standard in 2006 even before development of global standard. After development of global standard, we have revised our standards. So, we have adopted global standard in 2015 according to the country need from the evidence based on surveys. There are 8 standards. First standard is health empowerment. Other thing is having a good AYFH center with all what we have talked, and third is service provider and supportive staff related thing. The next thing is service package. Information system and quality improvement is other standard. Standard 6 is community support. Standard 7 is young persons participation. Equity and non-discrimination is the 8th one. So, its standards are having criterias. We are measuring whether we are going for these criterias. We are monitoring services and doing supervision to supervision checklist of this. This is a big package. Adolescent and youth friendly health services in the field. We will discuss about it. So, throughout the life cycle, care is provided by field health staff, MOH and the staff. Adolescent, youth and school children is one main stage of this life cycle. So, what are the field health services on AYFHS? At field, public health midwife is visiting the families. So, they identify adolescents and register them. They identify high-risk adolescents. They either provide necessary care or refer to MOH, Young-Pearson Clinic at MOH or hospital clinic. If they are at a high risk, should be given priority, they refer immediately to MOH. So, they will be provided service any day they go to the MOH clinic. Referred to AYFHS clinic. If it's not that urgent, they will be referred to Young-Pearson clinic. And clinic services. There may be field clinics as well, following up the adolescent and youth in the field. And in a youth training center, we have several initiatives established. Adolescent youth health module was introduced to the youth trainees. Training of instructors were carried out and enabling environment at these centers and medical screening and counseling. If they invite MOH to do a medical screening, MOH are bound to go and do. And that is where intersectoral coordination is needed. If they want counseling, it can be arranged. Adolescent at workplaces, health education, health promotion, parenting programs in the community. Adolescent need specific attention of the parent. Parent-adolescent bond is the most important thing. So, parenting programs are needed for our community to work with adolescents in their families. Role of health. Well, health care providers, we provide information, skills and services and do referrals within health sector and non-health sector. Adolescent youth friendly clinic is called as YOMPS. In hospitals, there are 5-day functioning clinics. There is a separate center. In MOH, they are having once a month or once in 2 weeks a clinic for adolescent and youth. That is called YOMPS clinic. MOH is conducting it. Adequate steps have been made to publicize it. The community should know it. Young people can be referred to this clinic by SMI, school medical inspection, PHM home visit, PHI sessions in workplaces, training centers, and they can come self-referred as well. We have discussed all this. So there should be at least one clinic once a month or once in 2 weeks. If there are more clinics, that would be better, but MOH and staff should be confident to get adolescents involved. Otherwise, they will not come. They will not think they are ill. Adolescent youth friendly clinic objectives. To provide updated, technically correct, culturally acceptable health information for young person in the area. Content should be technically correct, culturally acceptable, and it should be health information. To screen, manage, refer, follow up common adolescent health problems, even minor illness, SRH issues, nutritional problems, psychosocial issues. Whatever the problem adolescent is having, we have to screen the adolescent and manage and refer or follow up as suitable. Provide contraceptive or family planning services, immunization services if they have not received, counseling services, weekly iron folic acid supplementation if they have not received from the school for that particular year. So, objectives are to provide updated, technically correct, culturally acceptable health information. Screen, manage, share and follow up, and provide certain specific services like contraceptives for those in need. If immunization missed, arrangement for immunization, counseling services if missed, weekly iron folic supplementation, arrangement for that, and to give inputs for health promotion, and one main role is life skill development initiatives. So, YOMPS clinics, you might have seen this billboard, it is there. We have provided them from many health bureaus to major hospitals where YOMPS clinics are there. Not at all hospitals still. There are 34 hospitals having YOMPS clinics at the moment. So, target group is 10 to 24 age group adolescent. So, if somebody older than or younger than this comes, the services are provided. So, how do we conduct this center, YOMPS? There is a protocol. This protocol is for hospital centers as well as YOMPS clinics in MOHs. So, it is for adolescent youth friendly clinics at MOH as well as for hospital centers. So, standards are developed as I discussed in 2015, and in parallel to that there is a supervision checklist, assessment tools where we can assess, everything is there. So, what is in core package? There is facility based care where if patient comes to the clinic or center, at the facility we are providing needed services. In addition to that, sexual reproductive health, as services, nutritional services, immunization services if they have not received referral or arrangement for that, counseling services, we can do counseling with incorporation intercollaboration with other sectors. DS officers are having counseling officers. We can invite them to come to our clinics or to center 1 or 2 days. In some areas it is happening. So we can provide counseling. Some of our staff trained. Outreach services in the community, and you can go back to the community and provide a service. So we have discussed 5 components of facilities based services: medical screening, SRH, nutrition, counseling, outreach program. Medical screening. How do we screen? Globally, there is a job aid developed by WHO. As our healthcare providers are very competent, they know everything, no specific training is needed regarding job aid. It says the assessment or detailed history should be taken. This detailed history is taken on HEADS. What is HEADS? Have you heard about HEADS? It includes home and environment, education and employment, activities, drugs, sexuality, suicide prevention, depression prevention. And suicide prevention means that we are taking the history, whether they are having suicide ideas, attempts and all, depressive symptoms or all. It is mainly history taking. Home, history should include home, education, activities, what they are doing, drug, whether they are taking drug, alcohol or tobacco, sexuality and suicide attempts or anything. So it's straightforward, we are not going to ask these things. First we will generate a friendly environment for them. They may be coming with a headache, but problem may be that they are addicted to drug or they are abused or anything. So we have to spend time and take a detailed history, not that we are writing all this down, but we should take our communication should cover these things. First we have to establish friendly environment. Then examination, as you medical care providers, you know, oral health, heart, lung, BMI, vision, hearing, all this should be covered. That is medical screening. So we are using HEADS. SRH package. SRH, clinical management of SRH issues, prevention and health promotion, information and counseling on, they may be having menstrual problems, development problems, they will not identify changes in development as normal, they will think it is abnormal, they will compare with their colleagues, sexual concerns, pregnancy, if they are pregnant we should provide care, contraception, teenage pregnancy prevention, sexual management for sexual abuse cases, life skill development to avoid risk behaviors. That's the main thing. We have to prevent SRH things and all other issues by life skill development and healthy lifestyle development. And management of STI, if they come, they will screen and we will refer to the STI clinic if they are reluctant, syndromic management, nutritional service, BMI screening, nutrition counseling, prevention and management of anemia and other micronutrient deficiencies. It is very important. All these in nutrition assessment, how do we identify whether their BMI is correct or they are having problems? We have to use adolescent risk score charts. It is in CHDR as well as in school health program book. And counseling service. Our staffs are competent, some are trained in counseling, and basic counseling as doctors, nurses and other staff you can do. And there are counseling officers and DS office. You can involve, refer or invite them to your clinic for needy clients as well. So referral linkages between two sides are important. So you have to include them in your programs and invite them, have a good linkage. So outreach services in community and other settings are very important. So we have discussed first outreach component, that is PHM's domiciliary visits. So they are visiting families. So they can provide information and counseling on SRH problems, menstrual issues, puberty related issues, prevention of teenage pregnancy and those things. BMI screening and counseling, nutrition counseling, contraceptive services, educating parenting of adolescents, they are meeting parents. So parenting is important. Outreach services in the community and other settings. Annual health sessions at youth corp or vocational training institutions and technical colleges. There we can do medical inspection. Youth camps, there is one point that we can do medical inspection, life skill development, BMI screening, healthy cooking, and group sport, exercise, aerobic, meditation, mindfulness, that means career guidance, everything. And peer leaders training. Peer leaders can be used as health information dissemination points as well as health promotion. Council members of youth and children's clubs, prefects of the school, scouts, girl guides, life skill program, SRH, and peer, that is what we discuss using peers. So adolescent health in the field, medical officer of health of the area has overall responsibility. At least one adolescent youth friendly clinic should be conducted once or twice a month on a fixed day at MOH office or field clinic. Adolescent health in field. The field health staff as well as hospital staff should send quarterly return to Family Health Bureau with copy into MOMCA. They should publicize the services among young people at school, vocational training centers, youth corps, workplaces, training places, and etc. So, further to that, these are the points we have covered. Adolescent youth friendly health service in field. First, awareness generation program among adolescents as parents. Young people are referred to clinic from school medical inspection, PHM home visit, PHI sessions, occupational or vocational training sessions. MOH and staff are developing partnership with other educational institutions, social service department institutions, vocational training, DS officers, and NGOs. So, this structure is essential to provide adolescent youth friendly health service. So, we have developed a package to case-based scenarios where we use to develop life skill development. What is this package? This package, we identify 10 adolescent girls or boys, we can use same package, but this should be girls or boys separately. We take it as girls, and a PHM or healthcare provider will tell the story by turning page to page, and the guide is there. At that point, we get the inputs from adolescents and their life skill will be developed. So, it's a detailed package. And assessment tools of standards, this assess the standards, and supervisory checklist where we use to supervise, it's a supportive supervision. And there's a guideline on adolescent sexual reproductive health service provision for healthcare providers and leaflets. This is yompsa.lk website, yompsa.lk, www.yompsa.lk. So, adolescent can get health information on health conditions, and this is the billboard. So, in spite of everything is there are challenges. What are the challenges? Lack of public health human resources. Public health workers are telling they are overworked, overloaded with work. Lack of priority at school or adolescent health, school health or adolescent health at all levels. Lack of coordination between health and educational sectors at district, provincial, and grassroots level. Issues in working with non-health partners. So, intersectoral collaboration is lack of financial support and for establishing ideal centers away from the hospital. So, if you want to read more, this is it, and all we are doing is for a better world for young persons. Thank you.